Sleep apnea is a very common disease that affects millions of Americans. Essentially, what happens is, when we lie down to go to sleep, the excess tissue in our throat and our tongue collapses backwards and blocks off our ability to breathe at night. When that happens, our brain struggles to get the oxygen that it needs, and as it struggles to breathe across that blocked airway, it causes us to wake up and gasp for breath. That gasping for breath and the arousal is called an apnea. Because of the constant apneas that happen for some people with sleep apnea, this can cause difficulty with heart issues, difficulty keeping your oxygen levels high, and poor sleep. Traditional sleep apnea treatments generally include a CPAP, continuous positive airway pressure. What this does is when you go to sleep, you put a mask on your face or nose, and that blows air into your mouth and throat. What this does is it stents open the airway. And by opening up the airway, it allows free passage of oxygen into the lungs and prevents us from having these apnea episodes where we'll gasp and struggle for breath. Over the last 5 years or so, new technologies have emerged to help with the treatment of sleep apnea. The main technology is something called a hypoglossal nerve stimulator. The hypoglossal nerve is a nerve that comes from our brain down into our neck and then innervates the tongue muscles. This is the nerve that helps us move our tongue out and move the tongue back and forth. In order to help us sleep better without the use of CPAP, the hypoglossal nerve stimulator is placed through a surgical incision in the neck onto the hypoglossal nerve. A small electrode cuff is placed around the nerve, and then a wire is tunneled down the neck into the chest. In the chest wall, we implant the small device. This computer controls when the nerve gets signals, and it monitors your breathing. Every time the patient breathes in and out, a signal is sent through the wiring up to the nerve in the neck, which causes the tongue to stick out. At the same time, stiffening up the throat and opening up the obstruction that was caused by the apnea. In this way, it is a replacement or an alternative to CPAP. Instead of having air blow in your mouth to stent open the airway, an electrical signal is sent through a wire that's attached to the nerve in your neck, and that moves the tongue out of the way and opens up the airway so that you can breathe. The ideal candidate for a hypoglossal nerve stimulator implant will have failed CPAP or be unable to use a CPAP machine, have moderate to severe sleep apnea, have a BMI less than 32 for commercial insurance or 35 for Medicare, and be able to tolerate a 2 to 3 hour outpatient procedure. Once the patient has met the surgical criteria for hypoglossal nerve stimulator implantation, the next step is to undergo an airway evaluation. This is done under general anesthesia, where the patient is put to sleep and the physician looks through the nose with an endoscope to examine and evaluate the way that the throat collapses. This is important because if the throat doesn't collapse in the proper way, the patient would not benefit from the implant. If the patient passes this part of the workup, then we proceed to the surgery. Surgery is accomplished under general anesthesia in an outpatient setting with a surgery that takes about 2 to 3 hours. This is done through 2 small incisions on the neck and on the chest. Through these incisions, the device is placed. Over 1 week, the patient is allowed to heal, and then they're brought back to the office for suture removal. 1 month after surgery, the patient is brought to the pulmonologist's office where the device is activated. Once the device is activated, the patient is allowed to go up or down on the settings to test out how well it helps them sleep. 1 month afterwards, they continue to follow up with the pulmonologist, and the device is fine-tuned to find the optimal level for sleep. Just as patients who use a CPAP will go in for a titration study to optimize the settings, this type of a sleep study will be performed approximately 2 months after implantation. One of the best things about the hypoglossal nerve stimulator is that it's easy to use. You turn it on with a remote over the chest device, instead of having to use a mask and a hose every night. Because of the ease of use and the comfort, patients are much more compliant with hypoglossal nerve stimulator use than they are with CPAP. Also, most people find great benefit from using it. Around 80% of people are satisfied with their device, as well as their bed partners. To schedule an appointment or get more information about the hypoglossal nerve stimulator, visit our website or call ENT Nebraska at 402-484-5500.